Hello, everyone, and welcome. Thank you for joining us for today's Let's Talk Compliance Roundtable, Provider Relief Fund Reporting Requirements and Compliance Concerns. Before we get started on today's presentation, we would like to cover a few housekeeping items. Today's presentation is being recorded for post-event viewing, and to ensure a smooth presentation, please remain on mute if you are not speaking. If you feel comfortable to do so, we encourage you to turn on your video. If you have a question for our presenters, please type your question into the meeting chat feature. We will do our best to cover all of your questions throughout the presentation. To view more attendees, switch your view from gallery to large gallery by clicking the three-dot icon and scrolling down to this option. If you experience any technical issues, please refresh your browser or leave the meeting and join back in. If you continue to have issues, please contact Foley's tech team at videoconferencing@foley.com. or dial 1-866-319-5800 extension 2. As a final note, a short survey will appear in your meeting chat at the conclusion of the program. We would appreciate it if you would provide us with feedback on today's webinar to help us improve our future programs. And now I will turn it over to Jana Kolarik and Angie Caldwell to introduce our presenters and begin the presentation.
Thanks so much, Maggie, appreciate it. Good afternoon, everybody. We're pleased to introduce the joint Foley and PYA Let's Talk Compliance discussion regarding reporting requirements and compliance concerns related to provider relief funds. Our Let's Talk Compliance event are in their third year, and we're happy to offer this expert Q&A to you. One of the presenters is Alexis Bortnicker, a partner in the Foley's San Diego office, who counsels clients on transactional and regulatory matters with an emphasis on counseling health systems, hospitals, and other providers in managed care, advanced payment models, and physician contracting, and who's been working in the last year in helping providers with issues that have been raised by funds paid under the Provider Relief Fund. Angie? Angie, were you able to join?
Well, I was making the phone call. Welcome to 2021. So I'm so sorry. Everyone, let me start over. Marty, give us a wave. So Marty is the managing principal of our PYA Kansas City office. She's a member of our compliance advisory services team. She's a JD. She does many things, and she loves complex technical topics, and so that's why she is serving on our panel today, our esteemed panel, to discuss PRF. So we're happy to have Marty. I'm going to turn things back over to Jana, who is hopefully going to take herself off mute so that she can talk to you about our pre-submitted questions that we had related to and as part of the invitation for this event.
Yes, thanks, Angie. So we did solicit questions in advance, and you guys came through with lots of questions that Alexis and Marty will address. So Alexis and Marty will set the stage, and we welcome your questions and input as they talk through this hot topic. So Alexis and Marty.
Thanks, Jana. I'm going to kick us off. Thanks, everybody. I'm Alexis Bortnicker with Foley and Lardner. Our thinking here, so initially Marty and I had talked about, having an agenda, and then we got the volume of questions and realized that this really probably is the most useful to just go through your questions, since a lot of them were repetitive, and really it's just a good way to see that everyone has questions. I mean, I think anyone in the provider space who's been dealing with provider relief funds for the last 18 months, it's been nothing but question after question since the first amounts received in people's accounts and sometime in early April and May last year. And so we're hopeful that, one, that we'll answer some of those questions to the extent we can, and two, that we'll provide a forum where you'll see that you're not the only one in this in this weird space where, everyone's trying to do the right things, wants to account for the funds, probably has a real need for the funds, but also don't want to get stuck, having to return the funds or having any penalties associated with the funds, which is the real fear. And so hopefully we'll answer some of your questions, and if at the very least we'll provide an opportunity for you for us to create dialogue and see where the open questions are, and create some community around the fact that there are a lot of open questions, and I can promise you're not the only one feeling frustrated. So we thought we would take a few minutes and just start off with our big picture, best advice, and so I'll kick it off and then I'll pass it on to Marty. But I do think that there's a lot of questions. There will, as I said, there have been questions, there will be questions. And so the best advice that I can give is, work within your organization to come up with rational, reasonable approaches to allocating costs, to allocating expenses, to determining revenue, and then document, and make sure you keep good files should an audit come. I think that's the best advice that we can give. I think it's going to be very hard for the government to come back and claim that people use the funds, fraudulently, or there's false claims in how these funds are used, assuming an organization accepted the funds, provided accurate information before they got the funds, and then, used reasonable approaches to how they allocated and or account for the funds. I think because there is no regulation that governs this, because there is so little guidance that has been ever changing. Marty and I were talking about the fact that just this morning the FAQs are new. It's just constant. It's going to be hard for the government to really take this into sort of the false claim level, which is really the fear. So there may be some recoupments, and so the best that you can do is to just create a paper trail that shows the sort of the right intent in spending these funds, and then sounds ridiculous to say, but hope for the best. But I think that's, within the organization, understand your approach and document it, and then, be ready for an eventual audit. So that's my 3 cents. And with that, I'll kick it over to Marty before we start digging into some questions.
Thanks, Alexis. So for my 3 cents, in terms of just the technical process of reporting, HHS has done a good job of producing reference materials, all of which are available on the CARES Act Provider Relief Fund webpage. I will not bore you with a website, just Google Provider Relief Fund. It's the first thing that comes up every single time. But the starting point, of course, the Bible we have at this point is the June 11 post-payment notice of reporting requirements. That is a 6 to 7 page document. I think I've read it backwards, forwards, sideways, up and down, as I'm sure Alexis and her team has as well. But that is our most concrete information with regard to guidance on the reporting process. Again, in terms of mechanics, HHS has published a portal user guide on submitting reporting information, very helpful. They have data entry worksheets, which, going to Alexis' points, help you with the documentation of the information that you submit. And there's actually a very helpful YouTube video, which is a tutorial on the reporting portal. It only has 2,300 views right now on YouTube, so we need to make sure that ratchets up because it is actually very useful. One can go back and start and stop very easily on it, as I have done, trying to figure out how they are calculating lost revenues. But that's all just the mechanics. It's amazing to think that HHS did not speak publicly to the provider community about the Provider Relief Fund until July 8. That was the first webinar they had done. Otherwise, it was always these continuing line of FAQs, which were providing us basis, which if you have tracked those, they have truly been a chameleon. They've changed colors and changed directions several times. So it really comes down to us as providers to explain the logic behind our decision-making on what to include in reporting and how we've used the funds. And it needs to be contemporaneous. So it does need to be meeting minutes and documentation of invoices and conversations you've had with peers, because that's going to be how you tell your story after the fact. I mean, there will be auditing because, I mean, CMS CMS. It's never CMS, it's HHS. Why do we keep blaming CMS for this? It's actually HRSA that has done this to us. But they have promised since the beginning with those terms and conditions that you attested to back in April and May and June. They said very clearly there will be auditing. And there is monies reserved out of the Provider Relief Fund for auditing. And if you registered for the last 2 webinars that were posted, the 2 Wednesday webinars, it takes you to the Optum site to register for those webinars. So it is clearly there will be an army of folk behind this that will be reviewing information. I kind of joked around that it's the return of the RAC audits. Hopefully not. The difference here, though, is that we're dealing with very amorphous rules. They are not regulations. They don't carry the weight of regulations. And so it truly falls on the provider to demonstrate under a reasonable, prudent layperson standard that what they've done with these monies in the heat of the coronavirus pandemic has been appropriate. So there's my 5 cents worth, Alexis. I'll leave it to you to up the ante as we jump into the questions.
No, I think that those are all really good points. And so thank you. I'm going to start with a question that I think ties really to what we were just talking about. And the question was, what's the best practice for tracking funds, use, and entities which qualified? How are hospitals documenting their approach for future potential audits, which goes right to this. And I think Marty just mentioned it. I think folks are doing this in any number of ways. We've seen, I have one hospital who actually implemented a policy for how they attributed or calculated revenue and therefore lost revenue. And they took it through the way they do policies. They went to the board, it got approved, it's formalized, documented. I don't know that everything needs to go that far, but the point is that there should be paperwork, there should be receipts, there should be meeting minutes if these decisions were discussed at compliance committees, or if there was a special committee formed to address Provider Relief Fund spending. Minutes are helpful. Even I have another client who what they did was this was back in the day when we were dealing with high impact cost funds and how they determined what a COVID case is, because the guidance on how to determine what a COVID case was literally changing every day up to the date of reporting. And they did similarly. They wrote a narrative and they had a narrative approved by a committee that they sent it to the lawyers and then they brought it back and they have it in a file, right? And so whether it's a narrative related to a certain expense and if how that expense ties back to COVID, sometimes it's not 100% obvious. Again, so receipts, narratives, emails, all that should just be collated and kept together. And ideally, there should be more than one person in the organization who understands how it all came together so that, timing of these things, it's really unclear. What we do know, there's a new FAQ, I think from July 1st that says, somebody asked, will we get some sort of sign off or checkbox that you've submitted everything that you need to submit and you're done? And the answer is no. HRSA has just said that, you have to comply with the requirements. I think it's of the CFR for record keeping, and that's 3 years, and that you should be prepared for an audit effectively during those 3 years. So there's not necessarily going to be a yes, you're good, or no, there's not going to be a red light, green light, orange light at the end of your submission. They're going to take their time and they may or may not come back. And so, I think the documentation can take any number of forms as long as it exists and it's put together and it matches the numbers match the story or whatever it is. And if there are if there have been internal meetings or pathways for how to deal with this, minutes are also really helpful. So that was my first question. Marty, did you have anything to add to that?
I think this is going to be related, Alexis, because my first question is what happens to other assistance received? And as Alexis stated at the top, this is in large part, compliance review, but it's a therapy session because you all should appreciate that we received an amazing amount of questions from registrants. And it was interesting how many of them were the same question asked different ways. And this was probably the number one question we received is some version of other assistance received. It's the Trinity for reporting purposes. It's other assistance received, expenses attributable to coronavirus, lost revenue attributable to coronavirus. And when you get on the portal, you'll see that's the big chunks of information you're going to be inputting. This issue of other assistance received ties to the statutory language that requires a recipient of funds to use those funds as last resort. That there is no other source to fund lost revenue or to fund an expense. That's when you can start opening up that cash bag of provider relief funds and begin using those dollars. In the reporting process, and this is, again, this is where the FAQs went back and forth, but where it's ended up in the reporting portal is that the information you will submit on other assistance received is by category. So you'll talk about your Paycheck Protection Program funds, you'll talk about FEMA dollars that you received, you'll talk about state assistance, you'll submit all that information, but it's very clear that that does not impact the actual calculation of your lost revenue and expenses. It's an honor system. It's you reporting, this is the information, this is the monies we received, and implicit in that is, and we use that money to offset our expenses and lost revenue. But what we're reporting here to you, HRSA, is the expenses and the lost revenue that's not covered by other assistance received. So yes, you have to report it. Yes, it needs to be accurate. Yes, you need to be prepared to defend those numbers on audit. But when you get to then the calculation of lost revenue and expenses, the offset of the funds that you received, then it's not going to enter into the calculation. So that's what happens with other assistance received. Alexis, anything to add?
No, that's a really good point, that you're putting in the numbers, but the assumption is not that expenses, once you put in all your expenses, you have to first deduct those numbers. They are two separate screens and two separate calculations.
Yeah, because we were worried at one point that what was going to happen is you'd input your provider relief fund received, and then you would add your PPP dollars and add your FEMA dollars and add your state dollars. So then you were just subtracting down from a larger number. No, it's saying, let's start with PRF, but we're going to assume you've already offset all of this.
Yep. Marty, my next question is, have you heard anything timeline or otherwise regarding OIG's intent to audit providers who have received provider relief funds, which ties into all this, and I think ties into the anxiety that people have about what this is going to look like. And I think the answer is no. We've heard every indication that there will be audits. You know, the fact that Optum is running this, the fact that it has been since the first terms and conditions that audits will come, the fact that if you choose revenue report revenue via option 3, you're guaranteed an audit. The fact that they've already said that, you know, there's higher chances of audits after, you know, as the money gets larger. I think there will be audits, and I think we know that, you know, they've pointed us to maintaining records for 3 years, so that we should expect audits over 3 years. But short of that, we don't have a real time frame.
Oh, so when you go through the reporting portal and you get to the last screen, and you've submitted all your information, it says, before you hit this button, do you fully appreciate that the information you have submitted will be used for purposes of audit? Sort of like the Miranda warning, right? Yeah. For PRF funds. So they've been very, very clear that that's where they will start the audit process, is the information you've submitted.
Yeah. So they are coming. We don't know when, and we don't know how often. And frankly, we're assuming by Optum, but, you know, there may be, I would expect that that's the first line of audit.
Let's see, can one use provider relief funds for construction costs on new additions to hospitals? And the official answer is, wait for it, it depends, right? We had the back and forth in the FAQs over whether you could only claim depreciation on equipment and capital costs. And initially I said, yes, you can only take 1.5 years of depreciation. Then they came back around Thanksgiving, which I thought was interesting timing, and said, no, if it's directly attributable to coronavirus, it would be appropriate then to include the full expense in your reporting. I don't know what the difference is between attributable to coronavirus and directly attributable to coronavirus in those FAQ language, but what it has come down to is if you can make a clear case, direct case, clear case, that in fact it was necessary to make certain capital expenditures that then to respond to coronavirus appropriately, then that would be properly identified as an expense on your reporting and appropriate for the use of PRF funds. It is, go back to this case of you have to have the documentation that says the reason we used these PRF funds to create negative pressure rooms for our facilities is we didn't have that before. Yes, it's going to have benefit to the hospital after this version of COVID-19. But it is going to allow us to respond appropriately in these cases. So that's the type of information you're going to have to present, and particularly why it is in the realm of directly related, as opposed to taking just the depreciation, the 1.5 years depreciation on expenses. And Alexis, please add to that, because that was sort of a mishmash of an answer.
No, I think that's exactly right. I think we had a lot of examples of that. We had a client who had to refurbish their rehab wing, which is something that was already, they had budgeted for over a number of years, but found themselves having to do much quicker because they needed the rooms, right? And so they're like, well, what do? We had already budgeted for that expense. And you're like, yeah, but you hadn't budgeted for that expense to kick in over 6 months. And things like that. They have a good story. The truth is they needed to move patients, and rehab rooms were required. And so can they attribute that full expense? Probably. I think it ultimately comes down to the story, unfortunately. But yes, I think that's exactly right. I think if you can make the clear case, then you can attribute the whole thing. So my next question is, I got a number of different forms. Are the allowable expenses incremental as related directly to COVID for physician or eligible, or for physicians eligible simply because the expense supports making the physicians available during the crisis? Another question was, can we deduct all of our mortgage and rent for normal office space, or only if we had additional more space in light of coronavirus? So the question is, if you had expenses that were ongoing, how can you attribute them to coronavirus? And the response that we've said to that is, so the FAQs do permit the reimbursement of marginal increased expenses related to COVID. So, if rents went up, if insurance went up, if it cost you more to keep your physicians, your nurses, you had to pay higher insurance rates or bonuses, retention bonuses over time, just to be able to spread out patients, things like, then it's very clear that these accounts are attributable. I think fundamentally, if anybody shut down for a period of time, I think those same expenses are again, can be counted. I think it gets much trickier if, we represent a lot of oncology providers who never shut their doors. And, can they attribute some of these costs if there were not incremental increases to COVID, if they continue to treat patients and continue to get paid for treating those patients? And I think the answer is probably no. I think there does have to be some decision making as to what was either incremental or an unnecessary expense, but for COVID. But yes, there is the ability to attribute incremental or marginal increased expenses as long as they haven't been paid for by other sources.
So my next question jumps into the wonderful world of lost revenue calculations. Can we document lost revenues based on March to May of 2020 under method 3, or do we still have to use all of CY 2020 regardless of the method we use? This is actually answered by the setup of the portal. So when you go and begin entering data, you will reach a screen that says effectively by which of the 3 methods you intend to calculate lost revenue. And remember, you only get to lost revenue if you, even once you paid for all of your COVID-related expenses, you had PRF funds left. So it doesn't even get to the lost revenue screen if you've already exhausted all of your PRF funds with expenses. But when you reach this screen, it says method 1, which is a comparison to 2019. You compare 2019 revenue to 2020 and the first 2 quarters of 2021. That's method 1. Method 2 is you're comparing a 2020 approved budget to actuals in 2020 and the first half of 2021. And then method 3 is any other reasonable method. You're going to report for all of those quarters. So you're reporting 6 quarters of information regardless. You cannot leave a box blank. It won't allow you to do so. So you will have to input that information, regardless of which of the three methods you're utilizing. What you learn from playing with the portal is that in the actual calculation of lost revenue, each quarter stands on its own. So when you enter Q1 of 2020, and if you're comparing it either to a Q1 of 2019 or the approved budget number for Q1 of 2020, if that number is a positive, i.e. you did better in Q1 of 2020 than you did in 19 or 2020 budget, it zeroes out in the calculation. Now, if it's a negative number, i.e. you did worse, it then becomes part of the calculation of lost revenue. So there's no offset. So if you had 3 bad quarters and then things turned to become more rosy, you at that point then the calculation of lost revenue would only be based on those 3 negative quarters. That was the best news, I believe, when the portal opened. But again, the warnings here, they want you to use the 2019 comparison. It's clearly driving you to a 2019 comparison, but they add the budget opportunity. But you then have to, of course, submit the actual budget and submit it's not an attestation. What's the term they use, Alexis? But it's sort of a promise by your CFO that this really, really was the budget.
Yeah.
And then it's super confusing because you submit the 2020 budget, but you're reporting on Q1 and Q2 of 2021. And actually the language in the manual is even more confusing because it then refers to 2019 revenues. And I'm confusing you by continuing to talk about this, but just appreciate there's no 2021 budget input. You're still comparing it against the 2020 budget. If you go for option 3 and you go free range in your explanation of lost revenue, then it's going to give you the opportunity to submit that documentation that Alexis has been talking about. How do you justify your methodology of calculating lost revenue? And this is where you're going to say it's not an apples comparison to look at 2019 versus 2020 or 2020 budget versus 2020 because of all these other factors that came into play. And that's your explanation you're submitting along with the actual numbers going into the portal, but it's those other documents you attach. And it's really that one opportunity you have to show your work in terms of the submission on the portal.
Yeah, no, I think Marty, you're exactly right. I think there are a lot of questions about the lost revenue calculations, and I have some that are short and some that are long, but I'll just tack them on since we're doing this now. Someone has asked, can you just report lost revenue if it's enough to justify the total amount of your provider relief fund payments? In theory, you can, but be aware that the way the portal is structured, they want your expenses first and then your lost revenue. So you're going to have to actually put in 0 expenses there, like in each bucket, before it'll even let you get to provider relief to the revenue number. So, if you have expenses that you can account for, you might as well put them in since you're going to have to go through those paces. But you could get to lost revenues if you need to. Or just lost revenues if you need to by zeroing out all those screens before. And then someone has asked, will there be scrutiny on lost revenue on the 3 options? Will the scrutiny be equal? The answer is no. CMS or HHS, I always do that, has been very clear that scrutiny will not be the same on all 3 methods, that they would rather see one. They're giving you 3 because they got enough comments of people who complained. And there are a lot of folks there's reasons why you need it, whether you had significant growth at the organization, so that the numbers just don't compare, whatever it is. That's still an option. So there is an option number 3 if you absolutely have to use it, but you should be aware that there will be scrutiny. And whether it's an audit or a requirement that they just say, no, we don't accept your reasoning and go ahead and give us options 1 or 2. But there will definitely be more scrutiny. But if you have to, because there's new providers and more income, and then it is what it is. I think Marty's right. The ability to do this by quarter is a huge win. I think there were a lot of grumblings from folks because when this started and when people agreed to attested to take the funds, they may have had a really bad quarter or 2. No one thought that we were supposed to, the initial reporting was supposed to be last year. No one thought that the initial reporting would be almost a year later, such that things may have turned around, people are back, so it's a different story. So I do think that's a win. And another question that came up to this, and I think is a similar question in the chat. If you received, so the question is, can provider relief fund distributions received before June 30th be combined with distributions received after June 30th to cover lost revenues incurred prior to June 30th? And I think the answer is yes, but not the other way around. So if you got funds, July 1st to December 31st, 2020, or January 1st, 2021 to June 30th, you could use all of that money to account for last year. Expenses incurred up through June 30th, 2020, you simply can't go the other way around. So the first 6 months worth of funds, if you didn't have losses or expenses, those may be lost, at least based on how the guidance is now. And one thing that we don't have a method to do, and so would have to be done in option 3, and we've had a lot of questions around from large provider groups who have, divisions or cost centers, is can you report losses on a cost center basis if, you had some cost centers that had huge losses, but others that didn't? And the answer is you'd have to use option 3, and we don't have any other guidance or evidence that would say that they're allowing that. So you'd have to put it in and see what happens. But overall, they're asking you to report revenue at an organizational level, and they're not giving folks the ability to do this on a divisional level. So those are just a number of questions that we've gotten to this.
Yeah, there's a bit of strategy here because you get one bite at the apple. You can use option 3, give it your best shot. And if HRSA decides they don't agree with your analysis, they will inform you and give you the opportunity within 30 days to resubmit using either option 1 or option 2. Now, however, there's no King's X here that if HRSA doesn't agree with you and then subsequently are audited, they could still then claim, no, we're not buying your explanation of lost revenue here. We're going to seek recoupment. So there is some play here, but it's a play with risk because there's just no guarantee that you're going to pass muster in that initial review by HRSA and think you're out of the woods. You could still, even then on audit, have that option 3 challenged, if that makes sense. So there is a little bit of strategy there still. I think you're going to have to be well prepared to defend that option 3. And there's so many instances where it applies. I mean, the one example of, we had this service line, we closed the service line, and so the revenues changed significantly. It just makes sense to use that you're going to have to make at least the first attempt at option 3. So, several questions around the magic June 30th date. And I know working with a number of rural facilities, this has been a particular thorny issue because for a lot of rural communities, the pandemic really became real in December of last year, January of this year. So they didn't have the early surges, they had the late surges. And at that point in time, they began looking very closely at issues such as, we need a better washing machine because our temperatures aren't getting high enough to make sure that we're properly cleaning the linens. Those are the types of issues. Or we need a new we need a new freezer because we're having to make sure that we're properly keeping things at temperatures. These are very basic block and tackling issues that they're dealing with, but they didn't come really online until this spring. And then because of as you all know, I'm waiting on a couch now that's not going to be delivered for a year. Same issues for our hospitals trying to address COVID is they couldn't get the construction completed. They couldn't get the equipment delivered. They committed the funds by June 30, but they didn't have the equipment in hand. HHS has come back and said, if you have incurred the expense, it would be appropriate to include that then in your reporting for funds received before June 30 of 2020 in this round of reporting that's due by September 30 of 2021. But they then still refer you to your method of accounting, accrual versus cash basis. And if you are cash basis, it becomes harder to make that case because you should have already have to have made the expenditure. But with accrual, you'd have more room because you have noted the expense, even though the actual product or the service isn't delivered till a later date.
Yeah, that's a good point, Marty. And just note, I got that question also was, can we account for revenue calculations based on cash or accrual basis? And the truth is, for all of these calculations, it's whatever your organization uses. So, there may be different results for folks based on whether you're cash or accrual accounting. And unfortunately, you have to just live with what you have. Should you get audited, and they'd want to double check that it's consistent with how you keep your books. I noted a question in the chat, and I know that there's a lot more questions in the chat, and so I'm trying to decide whether we stick to our script or we go to the questions in the chat, but I'll do a little bit of both. Somebody's asked, can we attribute executive time in dollars to COVID expenses? And there's an FAQ that deals with this directly from February of 2021, and time spent by staff, and that includes executive time, is allowable as a cost attributed to coronavirus, so as long as it wasn't reimbursed by other sources. So again, as long as doctor time is hard, if they're treating patients and patient care was paid for, then you can't do that. But you do need to have some sort of method of accounting for the time. We have one client who had, or I'm not at this point, I'm not sure if it was my client or Marty's client who was talking about recording all time with a special code, and then you have to differentiate between which of that was care provided and reimbursed and which of that was not. But you have to have a method for accounting for how much time was spent, and some sort of record, records that you can show that there was time, whether it's, there was a COVID COVID huddle daily that all of your executives went to, and you are still subject to the cap. But yes, there's an FAQ on that for the person who asked.
Oh, let's do some cost-based reimbursement, Alexa.
Sounds good.
Yeah, we had lots of questions on this one, and I have heard this question repeatedly because this is for critical access hospitals on cost-based reimbursement. This has been extremely challenging, and to all the rural hospitals, because with that, the special rural distribution. I mean, we had little hospitals, who have average daily census of 1, 2, 3, 4, 5, all of a sudden are receiving $4 million in provider relief fund amounts, and relatively small lost revenue. And so they've really been focused on the expense side of the equation. But these hospitals, because they use cost-based reimbursement, the issue has arisen, is that other assistance received? That if let's use the negative pressure room example, if we do that construction in the normal course of things, that would have been something that was included on the cost report, and then they would have received reimbursement for the Medicare share for that expense. CMS has been silent on this subject to this point. There is no guidance coming out of CMS to cost-based reimbursed facilities of how to treat expenses for which provider relief fund dollars were available. And so our interpretation, and I'm labeling this underlining, highlighting, it is our interpretation, it is nothing coming directly from CMS, but our PRF team, which is a bunch of accountants and auditors and compliance folk, as we've batted this issue around, it is use the funds today, which again are going to cover 100% of the costs, correct? Use the funds today, and let's wait to see what CMS advises on cost-based reimbursement. Because you won't be, we believe you would not be any worse off, because if it becomes a matter of offsetting on the cost report dollars that you receive PRF funds, you'd be in the same position. If there's some recovery and you're forced to move dollars over to the cost report, it's going to be just a matter of time through which you would depreciate off that particular expense. So I think for purposes of cost-based reimbursement, that in the today, as you're contemplating the use of the PRF funds, you act as would any other provider in identifying those dollars and drawing those dollars down, appreciating that there will be a day of reckoning on the cost report side. And whether I would suspect strongly that you will not have an opportunity to double dip, i.e. use the PRF funds, then also include the expense on your cost report for later reimbursement. But there will be some rationalization between HRSA and CMS on how to treat these dollars going forward.
At least we hope.
At least we hope. Or we'll have a lot fewer critical access hospitals, I guess is the bottom line answer.
Yeah.
there's just no interest or no
Right.
appetite in CMS to shut down a hospital that in good faith was using
Right.
dollars to respond to an emergency that was particularly challenging in rural America.
It doesn't make sense. Just a question just popped up in the chat that I'm gonna raise, not because I have an answer to, because I actually don't, but to show you how this is helpful, and the fact that most of us are in the same boat, and we're here to provide guidance where we can, but there is just a lot of unknown still. So there is a new FAQ that was released this morning, which Marty and I were happy to see 10 minutes before our call. It says don't include contractual adjustments in your calculation of lost revenue. And it's what does it, the question is, what does that FAQ mean? And there's two questions on it. And the answer is, it is not clear. It's a 2-sentence FAQ that's talking about, contractual adjustments and charitable care adjustments and whether or not you include them. Our thinking was it shouldn't matter because you just have to document what you actually get paid. And so Marty and I were confused, and it looks based on the chat like there's at least 2 of you who are confused as to what this means. And I wish we had a better answer for you. We'll take that in mind. I think as there are, there's technical sessions over the next few weeks with Optum where we can try to raise these questions, and I'm sure other folks will. But it's just an example of how there's clearly some context lacking that resulted in that FAQ. Somebody must have asked something that resulted in them putting out that FAQ, and without the background, it's unclear. And unfortunately, we don't have an answer. But hopefully that goes to show that we're all, again, that you're not the only one who's frustrated in the way these things are being handled.
Alexis, it just popped up on the chat. Hey, what you just said about cost-based reimbursement is the opposite of the advice we had been given. So, it's just proof that reasonable minds can differ on the interpretation of these rules. And we just will have to wait for CMS to make a determination.
Right, exactly.
I still think that, I will continue to make what I hope is a reasoned argument that in absence of the guidance from CMS, it's appropriate to use those funds, so long as you can draw that direct link to attributable to coronavirus, because that demonstrates action in good faith, which hopefully and should, at the end of the day, per standards of administrative procedures, should end up with the right results at the end of the day. It just may take us a while to get there. We also had a lot of questions about, do you expect this to be litigated? Well, we'll see. That's just going to be a matter of time as we go through, as there are audits through this process. There are determinations. The flip side is just as much an issue, is if we have auditors that in fact approve certain expenses, you may have other providers coming back and saying, hey, wait, we didn't include that expense because we didn't think it would be appropriately allowed. We want our money back. Well, we'll see where that argument goes. That's another FAQ we received today, is that now there is a portal available for you to send money back. And remember, it's not just money, it's money plus interest, because your PRF award is considered your PRF award plus any interest you have received on those amounts as well. So you may end up turning, hopefully you'll be the person that buried your money in the ground and have to return interest and the dollars back. So.
I was like, luckily most accounts these days have little interest, but
true. Oh, I think we're at the magic hour.
Yeah.
And Alexis, I think we got through
a lot of our questions. I can't say all of them.
Right. But we'll certainly take a critical look at everything that's been coming in on the chat and figure out the best way to respond. So it has been a steady cascade here of questions. But I guess if anything you can take away for the weekend is we're all in this together, and we'll do our best to figure it out with good advisors.
Thank you. Alexis, did you have some?
No, somebody said, did the money have to physically leave our hands to replace lost revenues? And the answer would be money's fungible. So yes, a lot of people put this money in an account thinking they might have to pay it back. And as long as you paid for things elsewhere, I think you don't have to have used these specific funds.
Outstanding. Thank you to our panelists today, Alexis Bordenker and Marty Ross. Thank you, Foley and Lardner from PYA, for co-hosting the event with us. 4 things. 1, be on the lookout for a blog to address the questions and address other comments that have come through as part of the event today. We really appreciate all of that activity. 2. Again, thanks for your questions, either pre-submitted or now. Please be on the lookout for our next PYA and Foley and Lardner event, which is being scheduled for September. And then we will have our 4th annual Let's Talk Compliance event in January, which we've already started to plan for you, and we really, really hope to see you there. So thank you everyone for attending today, and there was a feedback form that passed through the chat. We would love your feedback on the event.